Hi everyone. My name is Sarah DaCosta, and this is my supervisor on site, Michelle Newkirk, social worker at Bellevue Elementary, and I'll be conducting an interview with her. So, Michelle, what are some theoretical models from which the programs at Bellevue primarily works with?
So we try to use a trauma-informed approach in each of the programs that we use. Two in particular that we focus on are TCIS, which is Therapeutic Crisis Intervention for Schools, and the other is Second Step.
Okay, nice. What is the reasoning for selecting these models? Including, is it at the individual practitioner level or at a program decision level?
So the district adopted both of those programs, TCIS and Second Step, and Second Step is implemented school-wide, and TCIS is implemented based on whether the practitioner, like the teacher, has gone to a training or not. Second Step, they're both strategies in how to build self-regulation skills, how to improve your social emotional awareness and skills in that area. So while the district has adopted it, not every practitioner has been trained in both.
Okay, sounds good. What are some examples of approaches or intervention or strategies that are informed by the theoretical perspective?
So Second Step is implemented in the morning SEL block. So we have a portion of time in the morning when students arrive that they all receive some type of social emotional learning instruction. Second Step is done in segments throughout the year and each lesson builds on the rest. TCIS is more of an approach that we use with kids. So it can be as far as classroom management skills on the whole macro level of the classroom, and then it goes into behavior management strategies for when you start to see an escalation of behaviors occur, right down to co-regulation with an individual child if they are struggling with their own self-regulation, and then how to de-escalate and then teach some skills through that crisis response. So those are the two different ways we do it.
Okay, nice. Very informative. How are such interventions evaluated or measured?
We use academic performance, right, because we're schools, and so the goal is always to make sure that students are performing better academically. And if they're not performing well academically, what do we have to do to reduce whatever barriers? So academic performance, we use disciplinary referrals and visits to our student support center, which is an area that students can go if they need a break from the classroom because of difficulty with regulation. We also use school attendance, because that can indicate whether a student feels safe and welcomed and like they belong in the classroom. And usually kids that feel safe enough to have big feelings are attending school more regularly. We also use the school climate survey, which is administered in the spring, and we administer it to students and teachers and parents and families. So everyone has an opportunity to say how it is that they're feeling in school. So when we're teaching through a trauma-informed lens, the idea is that our academics increase, discipline decreases, including bullying, and our school culture feels like everyone belongs.
Okay. Are any of these tools used for measuring outcomes? And I think you touched base on that just now. So by using these measuring tools, you measure like if there's improvement over time and stuff like that. And how do you approach the situation going forward? Do you make adjustments to the intervention, like lessen the intervention, or do you continue or so forth?
So that's where it gets a little bit tricky, because if a student starts to do well because of your intervention, then in a typical setting you would say, well, then I'm going to discontinue or reduce the services because they're doing better. But typically they're doing better because of the intervention that's being applied. And so that's why I like the way that these two programs are layered, because every student is getting it no matter what. It's just based on their need, they're getting more of it. So for example, with therapeutic crisis intervention, every student is getting the adult through a trauma-informed lens, right? So the adult is always operating through that lens and through that framework to make sure that the students are able to trust them in those spaces. And that we're understanding how the brain works and how it is that they are responding to different stimuli and how it may be different from what we may be responding to. And then if they have an increased need, then the response is immediate. So it's not so much like, well, this student is doing better, so they won't need co-regulation. If the student needs co-regulation, it's immediately provided because that's how the practitioner is trained to respond.
Yeah.
Does that make sense?
Yes, it does. What our individual practitioners and the program has on Wool's view on like evidence-based practice? And I know that's a big thing here because you guys go off of like evidence and stuff that you see, and then that's when you intervene and put things in place. So, what are the views from the practitioner level?
So, I don't know if I'm going to answer your question correctly, but I'm going to say some things. If we're thinking about evidence-based practices, it's important that as educators we know they're not just the same kids sitting in front of us in the whole classroom, right? Evidence is indicating that even the culture of poverty that exists in Syracuse, that's a form of ongoing trauma that our students are experiencing. So to use that lens of trauma-informed practice and to make sure that we are constantly monitoring the students' needs and responding to them appropriately while still teaching the curriculum, right? Whether it be an SEL curriculum or an academic curriculum or both, using that evidence as far as how the brain works and how it is that we are functioning as a school. That's important, and then it falls back into academics, right? So we always look to academics to see if what we're doing is working, and if it's not, what do we need to adjust?
Yeah. Okay. Very good. How is evaluation used in practice and for the agency or for the school?
Yep. So that's where it kind of depends on how it is, like what we're evaluating and when. So academic testing is done more routinely throughout the year. And that's where we will consider students' engagement, and if they're not learning because they're not engaged well, then how do we use that data to inform our more macro and micro interventions for kids. Then attendance is monitored weekly, and attendance is always a symptom, and so how do we engage students and make sure that they have that sense of belonging? The school climate survey, I wish it was done twice a year so that we could see pre-test and post-test within the same year, but it's only done in the spring, so we're able to compare that year to year and then make some informed decisions throughout the summer on what our programming needs to look like beginning in the fall as far as family engagement. How do we educate families so that they're providing the same messages that we're providing, things like that.
Okay, very nice. It was nice doing this interview with you, very informative, and gave me a better understanding of how you guys operate, especially on the student support level. And yeah, thank you.
Thank you.
And that's the end of our interview. Thank you for tuning in. So the intervention that I chose from my agency was the attendance club. This intervention is used by the social workers to identify students that are struggling with attending school. They're way below the goal of the school as it regards to attendance, and this helped them to build like a relationship to help these children feel a part of a community and feel like they have the support. The program was started back in spring of last school year and has continued into this school year. Things has improved a lot. Above majority of the students from all grades have been attending over 90% during their cycle as attendance club members. And for the ones that have not improved, they will get further individualized support and help, like, with their family support also, to help them to improve their attendance. The reason for this club was because the school they weren't meeting the standardized goal of the city school district, and they wanted to implement something that would help the school on a widespread level at all grade level. So the attendance club was implemented. Okay, so to look more into the attendance club, so students are identified when they are fall in the 80 to 85% attendance rate. That means they're almost there and they just need a little more help to get where they need to go to fall over 90%. And the social work team will coordinate invite these students with an printed invitation to take home to their families and to invite them personally. And this invitation will explain to them and the parents about the program, and include that there's a celebration after the 2 week span, which is a 9-day school cycle, if the student has only missed one day. Beginning the day one, the social worker will initially make a check-in each morning for the 2 weeks, and help to highlight to these students that we are grateful that they're here, and will congratulate them for doing so, and encourage them to continue on that same path. At the end of the first week, an updated is provided to their parents so they know where they fall. For example, if they miss one day for that halfway period, it would be like a 4 out of 5 days. So the parent will be notified about that so they can keep track of it. And also, if we see like they're not making any positive stride, we will call the parents and let them know, like, to get a feedback on what's going on and what is the barrier that is stopping them from coming to school. For the second week cycle, at the conclusion, all students that have been at least at school 9 out of the 10 days, they are celebrated at a special ceremony with the social work team, give them a certificate, a thank you letter to bring home to their parents, and they graduate from the program, the club. Oftentimes they will still want their little stamp as they would get when they were a part of the club, and that's fine. Like, we will still, if we see them, we will still congratulate them for being at school and to acknowledge them at the same time. Students who did not meet the 9 out of 10 cycle days are invited to participate again, and then we will give additional intervention and support as needed. The targeted population for this intervention are students with attendance just below the goal rate, typically student that falls between 85 to 80. The tool that's used to measure this is daily school attendance record. So the first literature is titled Measuring School Absenteeism. Administrative attendance data collected by schools differ from self-reports in systematic ways. And this study compares students attendance record with their self-report on authorized absences, meaning like students that are absent because of not like they come to school but they came to school late, so they miss the recording in the morning, student that has doctor's appointments, students that are sick, and so forth and so on. And this was done in a large sample to find out whether school registration data and student self-reports also measured the same behavior or have the same result. The measurement tools that were used in this data are school administrative data. Surveys were also done to ask student the necessary questions. Key finding was that the self-report on authorized data and the administrative stat data, they did not they were weak. The findings were weak because it was biased towards a certain set of groups, and they weren't accurate. Like they didn't coincide. They didn't go along with each other. The informations were different. The second literature was cited as scoping review of constructs measured following intervention for school refusal. Are we measuring up? For this study, it was conducted to find out the outcome of constructs and instruments used in intervention studies for school refusal and some related attendance problem. The measuring tools were different surveys and questionnaires. There were psychological questionnaires, like to name like 3 that was in there. As you can see, the rest of them SCARED, which is related to anxiety, which includes like phobias to why they don't come to school. SRAS, which is school refusal assessment tool, and SAI, which is school anxiety intervention, and so forth. When you compare the instrument used at my agency, there are some similarity because the agency also use administrative attendance tracking, but there are some differences. Like while my agency uses the administrative attendance tracking and like documentation of who was in the club, who graduated, and like incentives to encourage the students, to motivate them to make it to the 10th day with at least just one absenteeism. There weren't really any psychological measurements included routinely with, and there weren't any data from like the parents and teachers to really back up the information that was being provided. It was recommended from one of the study in et al. That it is good to include other like methods to assess an intervention to get like an accurate analysis of the data. As it relates to validity of instruments used in these articles, there were 2 main instruments used in these articles that can be validated, which are administrative attendance record and validated psychological instruments. Administrative attendance record face validity is high because it appears to measure whether the students are absent or present at school. The content validity is limited because it does not capture the reason why the student has missed school. The construct validity is partially present because while it is valid to know the student if the student's attendance behavior, it cannot tell the student level of engagement or anxiety or resistance to assist attendance. The criterion related validity as a mixture, because administrative attendance record will record student attendance, and there will be some but there will be some pre-planned absenteeism and signs of biases towards a certain group. As it relates to validated psychological questionnaire, the face validity is high because the questions directly ask about anxiety, engagement, and behavior. Its content validity is good if the right scale is used and covers the domain you intend for it to use on. The construct validity is well established with using these instruments, and the criterion related validity is usually good because of how the scales are rated by other clinicians. The reliability of these instruments differs because administrative attendance reports are considered to be non-consistent because it is a recording of students' behavior, not recording as a multi-item scale. While the reliability of questionnaire usually have good consistency, once you have the right scale that works for your population, it will be reliable and source for information. Okay. Some strength from the intervention that was identified from my program was it operates with under a behavioral reinforcement theory. It uses tracked progress and frequent review, which it allows rapid adjustment, and it's very practical. The inclusion of parents and also congratulating them for their contribution towards their children's attendance rate is very good, and it's an indicator of inclusiveness in the school. Concerns I have is while they're able to catch short-term behavior, it misses out on the broader and meaningful outcomes, and also the incentive might change the behavior short term and maybe won't really address the root of the problem. Continuing the recommendations that I would have would be implementing validated student self-report scale, pre and post 3 months, like before 3 months, like what were the barriers and so forth, and post 3 months, find out if the intervention really worked, like did they stuck out past the 2 weeks, and after the incentive, if it still work, and also like are we supporting them enough to avoid these barriers. Include parent reports, keep it short, include different barriers so we're aware of the different barriers as to why they're missing school. Keep a checklist of students that receive incentive, so the ones that graduate, keep track of it to see if kids are manipulating the system, and so if they need to take out the incentive from these set of students, because once the incentive is gone, they don't build a routine to always come to school. Get feedbacks from students about how they think the attendance club helped them. Examine the effectiveness on different biases based on gender, age, special ed, and SES. Use new tools like incentive tracker, parent feedback, student feedback, and all those stuff to see immediately how effective and durable this implementation is. Would I recommend changes? Yes, some of these changes I've mentioned before, and it's just to record the different reasons behind the absenteeism, continue to combine the validated scales and administrative counts and parent feedback, etc. Just depending on, and not just depending on just administrative counts. These are my references, and thank you for tuning in to my presentation.